Okay, so good afternoon, everyone. Welcome to the second day of Survivors Week. I'm Felicia Dobson. I'm a patient advocate here at Cancer Services. On behalf of Cancer Services, Novant Health, Derrick L. Davis Cancer Center, and Wake Forest Baptist Health Comprehensive Cancer Center, I want to welcome you. So thank you for being here with us today. We are so excited to have you all here today for our session on survivorship and integrative medicine. We have a very talented panel, and I know you will all learn something from them. I'm going to introduce them one at a time and let each panelist have about 10 minutes to talk to you about their area of expertise and how to maximize wellness, decrease stress, and be your best self. Anytime during the session, you can submit a question in the Q&A box on your screen. After the presentation, we will answer as many questions as we have time for. So let's get started. Okay, so our first panelist is Dr. Judith Hopkins. Dr. Hopkins is a medical oncologist with the Novant Health Cancer Institute and works out of the Kernersville location. She received her undergraduate degree from the University of Richmond and graduated from the University of Virginia Medical School. She has been practicing medicine in Winston since 1980. Her clinical interests include breast cancer prevention, genetics, treatment and survivorship, as well as GI malignancies and CLL. Her hobbies include reading historical fiction, skiing, hiking. She also enjoys spending time with her family on their 110-acre farm in South Carolina. So thank you for being here with us today, Dr. Hopkins.
Well, I'm honored to do it. So to start out, when we talk about survivorship, I think the number one question that I get asked by my patients is, how did I get cancer? Why did I get cancer? And is there anything that I could have done to prevent me from getting cancer? And so I think that the first thing we all have to understand is that you can do everything right. You can eat everything correctly. You can exercise properly. You can get all the amount of sleep. You can do everything perfectly, and you can still get cancer. So there are lots of things about cancer and how it develops and what we can do to prevent it that we do not completely understand. So the next question that I think I get asked is by my survivors. I get asked, well, now that I've had cancer and now that I've undergone treatment, what can I do to try to keep my cancer from coming back? And so I think there are 5 general areas that I'll talk about this afternoon about that. The first thing is it's incredibly important to avoid known carcinogens. So if you have a cancer, it means that your immune system, for whatever reason, is not quite as healthy as someone who does not have a cancer. And therefore, using a known carcinogen doesn't make a lot of sense because you're going to be at increased risk to develop cancer. So when we talk about known carcinogens, the number one known carcinogen, of course, would be tobacco. And whether you get tobacco firsthand by smoking it, or whether you get it secondhand by being in the house with someone who smokes, or whether you get it third hand by sitting in a room in a house with someone who is a smoker who smoked in that room, all of those exposures are going to increase your risk of developing any type of tobacco-related malignancy. And there's at least 2 studies that suggest that tobacco exposure in people who have had cancer increases their risk of getting cancer a second time by about 45% over people who do not smoke. So obviously, avoiding tobacco is a key component in trying to prevent the development of cancer and the recurrence of cancer. And then, of course, we want to avoid all known chemicals that will get us into trouble. And Russ is going to talk about this a little bit more later on, but one of the problems that we have when people talk about taking supplements and probiotics and high dose vitamin C is that we don't know where many of these products are actually made. And we don't know what fillers are in these products. And Russ is probably going to correct me later on, but to my knowledge, there's only been one study that has actually shown that taking vitamins in pill form has actually been beneficial. And it was in men, not in women. And it was using a Centrum Silver for men over the age of 50. So the best way to get probiotics and vitamins is in food. And Julie will be the first one to tell you that eating at least 5 servings of fresh fruits and vegetables every day is critically important to overall health and also to the prevention of cancer recurrence and to the prevention of cancer in general. So then the next question I get from people is, well, do I need to buy organic fruits and vegetables? And certainly I think if you can afford organic fruits and vegetables, at least in theory, they sound like they should be better for you because they're not going to be laced with herbicides or insecticides. But I think in general, it's more important to get the fresh fruits and vegetables than it is to worry about whether they're organic or not. The next thing I think that we all have a deficit in doing, and that is exercising. God created us to be active people. He created us to move. And so it's very important to get at least 30 minutes of some form of activity every day. You can walk, swim, jog, dance, stair step, Wii Fit, elliptical, rebound, treadmill, exercise bike, you name it. Anything that gets you up and moving is preferable to sitting. And if you have a job where you work at a computer all day long, you should absolutely positively get up at least once an hour and walk around your desk and do some knee bends or do some Pilates or do something to actually move and get your body moving. The other area that I find that patients tend to have a huge deficit in is getting an adequate amount of sleep. And one of the things that we have learned over time is how critical sleep is to our body's immune system. Now, you can get along with 3 hours of sleep or 4 hours of sleep or 6 hours of sleep, but an adult human being needs somewhere around 7.5 to 8 hours of sleep every night. And if you don't, you get into a deficit that affects your body's immune system and makes you at greater risk to develop malignancy. So just because you can get away with only 6 hours of sleep doesn't mean that it's healthy. So in general, most adults should try to get at least 7.5 to 8 hours of sleep every night. And then some people say to me, well, I can't fall asleep. And to which I would say, you need to be really good about avoiding electronic devices for an hour before bedtime. You need to exercise every day. That helps with sleep quality. Your room needs to be dark so that you can't see the alarm clock to know what time it is when you wake up. And particularly for women who are postmenopausal, the use of soft foam earplugs can be very helpful. So you need to get an adequate amount of exercise, an adequate amount of sleep. You need to eat properly, and you need to avoid tobacco, marijuana. More and more evidence is coming to light regarding carbonated beverages. Even diet carbonated beverages are not good for you. Apparently, they trick the brain and make the brain feel like it needs to consume more calories. And carbonated water seems to be very harmful for the kidneys, particularly as people get older. So that's sort of my spiel about lifestyle changes that I think are very helpful to help prevent the recurrence of cancer. And so now I'm going to let Russ take over after he gets introduced and talk about complementary or integrative health. We can't hear you. You need to get off mute.
Sorry. Okay, here I am. Thank you so much. So thank you. That was great information, Dr. Hopkins. I want to remind everyone to submit your questions in the Q&A box, and hopefully we'll have time to get to all of your questions. This is some great information that we're receiving today. Our next panelist is Dr. Russ Greenfield. Dr. Russ is the medical director of Novant's new Integrative Medicine Department. Integrative medicine is where the best of conventional medicine and complementary therapies are used together to maximize a person's healing capacity. He is board certified in emergency medicine, and in 1999 was one of the first 4 physicians to graduate from the program in integrative medicine at the University of Arizona College of Medicine under the direction of Dr. Andrew Weil. Thank you for being here with us today, Dr. Greenfield.
Thank you, Felicia. I have to say, when you say 1999, I'm like, oh my gosh, that's like another century. First of all, I just want to say thank you very much for inviting me to participate. And to all the survivors and family members who are on this task, first of all, congratulations, kudos to you. We welcome the opportunity to celebrate this time with you and to share some information that we hope will be of benefit to you. My own background, let me explain a little bit about what integrative medicine is. My peers and I define integrative medicine as healing-oriented care that takes account of the whole person. So certainly it's the physical, but it's also the emotional and the spiritual, the family, the community, the environment, it's all of that. And so we borrow this particular point from Chinese medicine, and that in integrative medicine, we define health as balance. And so balance shifts day to day, even moment by moment. But when you're considering the physical, the emotional, the spiritual, family, community, environment, all of that, how do you maintain that kind of balance? What we're really talking about is resilience. And so how do we work together individually and communally to actually engage and strengthen what we were all born with, that innate capacity to heal from what we've been through, to fend off illness, to prevent recurrence, and to be our best selves. Now, as you can imagine, there's a lot of information out there about all of this. And so too often in the oncology space, even in other areas in medicine, people are stuck in a space of almost like either or. Either we're going to do conventional medicine or we're going to do some of this complementary alternative medicine stuff. And there's a lot of space in between. And the problem is the two sides, if you will, don't communicate very well with one another. So in integrative medicine, what we try and do is say, how do you use the best of conventional medicine together with select diet and lifestyle measures that Dr. Hopkins wonderfully spoke about, and even select complementary therapies, complements to good conventional medical care, rather than either or, taking that equation and making it and. How do you use the best of both together in a way that is individualized for you? Now, in the survivorship space, we end up hearing from a lot of patients who say that even though it may not have been presented this way, they often feel this way, that after they have gone through their variety of treatments, they get the chance to come back to meet with their team. Their team says, "You've done great. Come back and see us in 3 months." And when they leave the door, that's when they fall apart. And they say, well, now what do I do? And what about all the support I was having and all the time I got to meet with my doctors? And how do I eat to keep this from coming back? And what do I do about this neuropathy or this fatigue? And how do I keep from being freaked out 3 weeks before my next scan, and on and on and on. And so that's a big place where we in integrative medicine can actually hopefully support folks in the survivorship space, is to answer some of those questions. When you read about all the variety of diets out there, do I go Mediterranean? Do I really need to go ketogenic? Do I fast? Do I not fast? There's more information out there and more misinformation out there that can actually be harmful for folks. And we try and make sense of it, and again, individualize it, personalize it, so that people first and foremost can take control where they can in their unique circumstances. And secondarily, but real close to that, stay safe by participating in activities that have been formed through evidence to be shown to be beneficial for you in your unique circumstances, and not doing something that might actually interfere with the treatment you are receiving or have received, or might actually be harmful to you. Kim Rhodes, our partner, is going to be speaking with you shortly about vitamins, supplements, and herbs. And just one thing I will put out there for you, because Kim is uniquely positioned to be able to do this. She's a conventionally trained pharmacist who's been practicing this space for a long time, but is one of the few pharmacists who knows vitamins, supplements, and herbs cold. And I will leave you with this before Kim speaks about it. There are upwards of anywhere between 50 and 70,000 different vitamin, supplement, and herb products out there. Kim and I and our peers have confidence in about 25 or 30 of them. And so being able to sit down with somebody and say, hey, which manufacturer, which product at all, where's the evidence, the data, just because the health food store person behind the counter is telling you to take this doesn't necessarily mean that you should. So we talk about things like diet, making sense of that for you as a unique individual. What exercise for you might be beneficial? How do we help you sleep? How do we help you use vitamins, supplements, and herbs? I will tell you that, Dr. Hopkins is unique as a physician because when you go through 4 years of medical school and residency and internship and all, you go through 7 to 10 years of some of the most unhealthy living imaginable. And then you're supposed to go across and sit from folks and say, here's how you should eat, here's how you should manage your stress, when we haven't figured that out for ourselves. So medical school training, nursing training and all is changing because in honor to be authentic servants, meeting with our patients, we have to first and foremost take a look at ourselves and see how do we take care of ourselves and in order to be a meaningful healing partner with the folks that we are working with. So some of the other questions that come up oftentimes for folks in the survivorship space is how do I manage these side effects that come up? What about neuropathy? What about fatigue? What about insomnia? What about anxiety? And there are many, many different ways to manage these different symptoms, not all of which come with a prescription. As it turns out, some of the complementary therapies that we use often for folks are things like acupuncture, Chinese medicine, massage therapy, because human touch, when applied appropriately, can be remarkably healing and can help in many different ways. Chinese medicine we bring up because it is actually an entire field of study unto itself that is based on what's called the qi, or the life force energy that each person has within them. And so what the practitioner actually does is try to engage that qi, balance it, tonify it, strengthen it, so that for each unique individual, you can be in the best place to respond well to your treatment and to stay well and to heal from all that you have been through. We help people to try and take control of their lives where they can and to make peace with the aspects within their lives and their health where they can't necessarily take control. So a large part of what we end up doing with folks when we meet with them is to listen to their story and to find out where they are in their journey and how best we might be of service. When anybody comes to meet with us, there might be from 3 to 25 different things that might be of benefit. But if we were to offer people 15 different things to think about to help them with some of their symptoms or their fears or anxieties, they're going to be overwhelmed. We're looking to offer people programs to participate in their care that are reasonable, rational, safe, actionable, and actually pretty easy. So usually when we talk with folks, we'll recommend 3, 4, 5, maybe 6 different things to consider, but we would ask you to participate in no more than 1 or 2 of them to start out with, and then let's visit again so we can see where you are in the journey. It is a journey, and in integrative medicine and throughout Novant Health Cancer Institute, we really honestly feel the great privilege to work with people in order to try and help them find their best selves in health, physically, emotionally, spiritually, and beyond. And in part, we do that because we're on this journey with you. To the best that we can, we're going to do our best to serve, not only in a professional sense, but as human beings along this remarkable journey where we take care of one another. So I hope that we might be of service. We'll look forward to your questions, but I know you're going to learn quite a bit hearing from our pharmacist, Kim Jerome.
Thank you. It always takes me a minute to unmute myself. But thank you, Dr. Greenfield. I'm sure there are going to be a lot of questions asked about how to balance those entities that you spoke of. So now I will introduce Mrs. Kim Jerome. Kim works very closely with Dr. Russ in the Integrative Medicine Department of Novant Health. Kim is a graduate of North Carolina at Chapel Hill, University of North Carolina at Chapel Hill, where she received her BS in pharmacy. She has over 35 years experience as a pharmacist. She frequently gives lectures on integrative and natural medicine and has taught classes at Queens College, UNCC, and Carolina's College of Healthcare Sciences. She is a contributor to Dr. Wild's latest book, Mind Over Meds. She sees patients by appointment for medication therapy management, and she counsels them on the proper use of vitamins, herbs, and other natural medicines. We welcome Kim Jerome.
Thank you for having me. So I was thinking this morning how I could tell you everything you need to know about herbs in 10 minutes and decided that's probably an impossible task. So I'm going to hit on the most important points and then give you a couple of ways that you can learn more on your own. So to start off with, I think the most important point about taking supplements is that we want to be sure that they're safe. And not only that the product itself is safe, but that it's safe for you personally. And in the United States, we have very lax laws and regulations regarding dietary supplements so that you can go in any health food store, vitamin store, and come out with something that's actually been proven to be unsafe, and that if you took it, could actually harm you. So it's an unfortunate state of affairs, and the FDA has actually announced an intention to more closely regulate the supplement market, but so far we don't have anything in that regard. So you just definitely have to protect yourself. We also know there's some dangerous beliefs out there. And a couple of years ago, a survey came out that showed that almost 4 in 10 Americans believe that cancer can be cured solely through integrative medicine. And that means just rejecting conventional treatment and just taking some sort of supplement or herb or having some other type of integrative medicine treatment. And we know that this is not true. And it's very dangerous because it leads people to only rely on the natural products, thinking those are better, and then to reject the conventional treatment. So as Dr. Russ said, integrative medicine means the best of both worlds. So we want to use everything together in a safe manner. So when a patient comes in and they have an herb or a supplement they'd like to use, whether or not it has a lot of science behind it doesn't bother me as much as whether it's proven to be safe. That is absolutely critical. So the next thing with supplements is the quality. And this is also an issue in this market. And we know that a lot of products out there for sale are really not what they say they are. And again, it's because of the lack of regulation and not a close oversight of this industry. And there's actually 2 states that have their state attorney general filing suit against some of the supplement makers for poor quality. And these lawsuits include mass marketers like Walgreens and Walmart and Target and several others. And sometimes when these products are tested, they not only don't have enough of the active ingredient, sometimes they have no active ingredient at all. And some of these products have been found to just contain rice, ground up rice granules and things like that. So you really do have to do a little research to find a quality product and make sure that what you're getting is coming from a reputable manufacturer. And so a way that you can tell that is to ask a trusted professional. Certainly we can help you with that. Or if you'd like to do research on your own, you can join something called Consumer Lab. And this is an online site that tests supplements that they buy off the shelf, just like you and I would. And then they publish the results of those tests. So they may have 20 or 30 different brands of something, and they tell you which ones passed and which ones failed and why. But the most important thing about that website, I think, is the scientific information that's provided there. So if you're interested in reading about something like multivitamins or fish oil, or something that was recommended to you that is supposedly good for cancer, you can go on that website and read what the science actually says. And it's not free. I think it costs about $40 a year, but it's well worth it for all of the information that's provided. And then all of the product guidance, so that when you go to purchase something, you know that you're going to get something that's a good quality product. There is another free source of herbal and vitamin information called aboutherbs.com. And this one is provided through Memorial Sloan Kettering Hospital in New York. And it's geared towards cancer supplements. So it's not a full compendium of all kinds of supplements, but most of the ones that come up often in cancer treatment. And you can go on there and read about whatever you're thinking about using and see, is it safe? Is it effective? Is it going to have any activity on what I'm trying to treat? So that's a good one as well, aboutherbs.com. And then you have to think about drug interactions. Let's say you've now found a product that we know to be safe, and we know that you've got a quality product because you've researched that and found the right one to purchase. But is this product right for you? And that there's a lot of other things that are encompassed in that, like what other disease states do you have? What other prescription medications are you taking? And we know that there are a lot of drug interactions and drug supplement interactions. So we have to make sure that in your individual case, that everything about what you're doing is going to be okay with whatever supplement that you'd like to use. Some of the quality products, problems in the market are CBD oil in particular, and probiotics, just for two examples. With CBD, we know that about 40% of the products that are tested out there do not contain any CBD, or much less than the label says, or they might be contaminated with something that could hurt your liver or kidneys. And with probiotics, again, a lot of the products that are tested, I know there was one study that showed 40% of the probiotics that were labeled as gluten-free actually did contain gluten. So you just have to be really, really careful about product quality and about your own situation. So just because your friend or well-meaning relative says, I think you should take this product, it's really helpful. It may have helped them and it may have helped a lot of other people, but it might not be the right choice for you. So just always think about getting professional advice before you embark on any of these supplements.
Okay, thank you so much, Kim. That was a lot of great information on drug safety and interaction. So I think next we'll go straight over to the Q&As, and we'll have some questions for you guys.
Okay, we have a lot of good questions that have come in. First, I'll start with Dr. Hopkins. You really struck a nerve when you talked about carbonation. We had some questions about mainly around carbonated water. So are you saying that carbonated water made from a natural carbonated spring water, made with natural carbonated spring water is not good? What is it about the carbonated water that is disturbing, and are there certain ones you should and should not drink?
So most of the data is with carbonated sodas, and particularly with diet sodas. There are no natural carbonated waters that I'm aware of. There may be natural springs to which carbonation is added. But I would say in general that you'd be better off with filtered water and fresh squeezed lemon than you would with carbonated water. And it's probably like everything else in life. An occasional carbonated beverage is probably fine, but every day or 2 or 3 times a day is not.
Okay, great. That sounds very good. The next question I'll throw out to Kim and Dr. Russ, and you can decide who wants to answer it. But are there any specific vitamins or supplements that you recommend for breast cancer survivors? And if so, which ones do you recommend and why?
Kim, why don't you run with this and I'll jump in after.
Okay. So I'd say that is much too broad a question. There are supplements that we do recommend, but it's such an individualized decision, and it's the type of cancer, the age of the patient, the other health factors that the patient has. So as Russ said, there are probably 20 to 30 products that we recommend routinely, but that wouldn't be good for everyone. So I would need more information specifically about that case.
Okay, that sounds good.
And
Is there,
go
ahead.
Real quickly.
Sure.
So part of what Kim does, again, because of her background as a pharmacist, she will review people's prescription medications. And then she can also speak to the safety of using any vitamin supplements and herbs with those prescription medications. A point to underscore in this regard, it says what is natural is not necessarily synonymous with what is safe. So if somebody is taking, as example, tamoxifen, and they've heard that turmeric is a good supplement because it has anti-cancer activity and it's an anti-inflammatory, and you would think, well, that should be safe to mix together. But Kim uniquely can meet with folks and let them know, hey, you know what, there's actually research data suggesting that turmeric may actually interfere with the action of tamoxifen in a small way, but a substantive way. And so we actually do not recommend mixing turmeric with tamoxifen. So it's those kinds of questions that can come up that wouldn't necessarily be able to be answered at your local health food store or, or an alternative medicine provider, where within the realm of Novant Health Cancer Institute, you can get the best answers to your questions about conventional medicine and good complements to that conventional medicine, as distinct from using what we would call alternative medicine. Alternative medicine is pretty much using anything but conventional medicine, and that simply is not what we believe in.
Okay, great. Kind of on the heels of your specialty, Kim, we've had a question about what is the cost to meet with you and have a discussion about medicines and supplements?
So I'm not sure of the out-of-pocket cost. This is covered by insurance, but I think if there is any out-of-pocket, it's very minimal. So it should definitely be covered if you have insurance. And if not, I think, it's less than $100 for sure, but I can't say exactly what it is.
Okay. And then can you do a televisit with someone?
Absolutely.
And discuss that?
Mm-hmm. Been doing those almost exclusively since March 25th.
Okay, awesome. You gave us several websites to take a look at, and we will include those in our follow-up email after today. So everybody will have a chance to see that and have links to those. Are there any apps that you recommend for your phone that is similar information where you can check kind of what's going on and what's good and bad?
As far as supplements?
Yeah, so yeah, supplements and vitamins,
I don't really use an app. I'm sure there must be something out there, but it's not something I use on a day-to-day basis.
Okay. All right, Russ, this is a great question. Are there any coping mechanisms or practices that you could recommend to help us during the pandemic? Being cancer survivors and different medications you're on, a lot of us are immunocompromised still. So a massage or acupuncture or any type of group exercise are not really recommended at this time. Are there any other coping mechanisms that you could recommend?
Indeed, it really is a great question. And Dr. Hopkins, I'll ask you to jump in as well. This time of uncertainty is compounded sometimes by the uncertainty that comes with treatment for cancer. And so you have this time of social distancing, and all too often that can become social isolation. We don't want people to be isolated. We heal somewhat on our own, but a lot of healing takes place in community. And so these kinds of meetings where we have contact with folks, we ask people, make sure you are actually not just texting your friends, but speaking with them, seeing them if you can by a Zoom meeting, etc. Be with people but social distance, while at the same time making certain you take care to manage any risk that you may have that might put you at greater risk for COVID and things like that than under ordinary circumstances. So the first is to realize that these are unusual and stressful times. And when we acknowledge that, we can do well by just offering ourselves a little bit more, being a little more gentle, and a little more kind with ourselves. That doesn't necessarily mean eating ice cream every night, but every once in a while, that's okay. Reaching out and even asking for help if you need it. That's part of what we all do here at the Cancer Institute. We recommend things like comedies, watching comedies that make you laugh, reading things that inspire, still participating in your spiritual practice, however you might define that, listening to music, practicing meditation, things of that nature. All those types of things work. Now, the complementary therapies that you mentioned, like acupuncture, massage, those types of things, indeed, we want to be very careful about that, especially in the community. But I will say that within the rubric, within the umbrella of Novant Health Cancer Institute, where we offer those types of things, the one thing I can guarantee you is that we hold to all the COVID-related precautions about keeping rooms clean and sanitation and minimizing risk. And so we still do recommend many of those therapies to unique individuals. Under ordinary non-COVID circumstances, of course, we support the well-established acupuncturists and massage therapists in the community, but because we can't speak to the precautions they are taking in their spaces, we actually recommend that if people are going to participate in those activities, that they lean more towards getting them under the auspices of hospital or the Cancer Institute.
And I will add to that I think that many patients, particularly those who have completed therapy, overestimate how immunosuppressed they are. So I think that it would be very appropriate to talk with your oncologist and get an assessment of just what your immunosuppression is. And it's certainly appropriate to get together with family or friends outside with a mask, 6 feet apart. You know, you can't hug, but you can certainly see each other. You can chat, you can get under a tree, a shade tree, you know, make some homemade ice cream. There's some things you can do. You can watch outdoor movies on an old sheet hanging from a tree. You have to sort of get creative, but all of us, the human species, is made to be with other members of the human species. And this particular crisis has led to a lot of isolation that's very challenging, whether you're sick or whether you're well.
Thank you. That's some great information. Dr. Hopkins, another question. You talked about organic and, you know, trying to eat organic or purchase it if you can. It is, of course, more expensive. We did have a question about the, quote, dirty dozen fruits and vegetables that you can read that says you should only purchase those organically because of the pesticides. Can you speak to that a little bit? And is that something that people should stick to, or you still can eat those fruits and vegetables if they're not organic?
I think in general, the safest way to get fruits and vegetables is to raise them yourself. You know exactly what's gone into your garden. That is not practical for a lot of people. So I think the next safest way is to know your farmers at your farmers market. Talk to them, find out what type of herbicides or pesticides they use, if any, how they raise their products. The term organic does not have one set definition. And so I think it's far preferable to get fruits and vegetables from a farmer's market than it is to get from the grocery store. When it comes from Chile, or it comes from California, or it comes from Micronesia, you have no idea what type of water source it's been exposed to, whether that's had dirty water, irrigation. So yes, I think the term organic, unfortunately, is not well defined. And so I think if you can go to a farmer's market, find a farmer, talk to them, that's probably the safest way to do it if you can't raise them yourself.
Okay. Kim, can you recommend a probiotic? And also, are there certain brands of supplements that are more likely good than other brands? Or does it depend on the actual individual product?
It does depend on the individual product. There are some companies that make high quality supplements across the board. One would be Carlson. Another one that's widely available is Nature Made. Nature Made is mostly a vitamin company. They make some herbs and supplements, but mostly vitamins. So for everything else, I'm really, you know, I go with what the product is. Like fish oil would not be the same company that makes probiotics. So for probiotic, we often recommend one called Culturelle, and that's a good all-around basic one for most people, and it's widely available. The price is good, so that's a good choice. It's funny enough that one of the most popular probiotics out there is called Align, and it's one that's often recommended by doctors, unfortunately, but it was given a grade of D by a third-party testing laboratory. So even when it's made by a large pharmaceutical company, it doesn't always mean that it's going to have good quality or good formulation.
Okay. Russ and Kim, how do you get an appointment with integrative medicine? Does it require a referral, or do you just call, or how can you get it set up with that?
It actually does not require a referral, though we are fortunate to get a number of referrals from our colleagues. So if you feel like we might be of service to you, you can bring it up to your oncology team. They can make the referral, or you can simply contact us directly. Most of the visits with the physicians, the physician assistants, and with Kim, they are typically covered by insurance. You should know that many of the complementary therapies like massage and acupuncture are often not covered by insurance. We are actively exploring ways to try and make certain that these therapies can be more widely accessible. One of the things we're looking at is what's called community acupuncture, where rather than being in an individual room receiving acupuncture, which can get kind of expensive, you can be in a room with 4 or 5 other people, spaced out. Nowadays with COVID, it might only be 2 or 3 other people, so you're 6 feet apart, but it's as effective. You don't have to get disrobed. Usually only get the front of your body treated, and it's far less expensive. So acupuncture is offered in our Charlotte office, and we will be offering acupuncture starting towards the end of September here in the Winston-Salem market. We already have oncology certified massage therapy and oncology certified yoga therapy. So we'll be looking to build on some of those. One of the questions that came up on the side was, what about DOs, or doctors of osteopathy? And so there are MDs like myself, and there are DOs, doctors of osteopathy. And probably if I had to do it over again, I would go to DO school, because osteopaths practice just like MDs, but they also know how to use their hands. Not the same like a chiropractor, but in very different ways that can be very beneficial. The challenge, however, is that 85 to 90% of all the DOs out there practice just like we MDs do. They don't use their hands anymore. But for the 10 to 12, maybe 15% who still offer what are called manual therapies, DOs can be invaluable, especially for conditions related to pain.
Okay. One other question, going back to the tamoxifen and turmeric. Is that also true and not a good interaction if you're using natural turmeric, such as what's found in Indian food?
Kim, you want to take that?
Sure. No, we don't tell people to change their diet if they're on tamoxifen. If you're eating some turmeric as a spice in your food, that's fine. The problem comes in when you're taking a concentrated supplement on a daily basis. That would be maybe 10 to 20 times what you would get in any sort of food. So yeah, if you want to use turmeric, it's in mustard, it's in curry powder, that's fine to continue that.
Okay, great. Dr. Hopkins, can you speak to how to assist people in getting a good night's sleep, if that is something that's really hard to do? Is it something you should turn to medicine, or are there ways to help assist with sleep?
So unfortunately, the problem with sleeping pills is that they rarely get you into the good sleep we call REM sleep. That is the healing part and has to do with the immune system. So what I tell patients is to try the cognitive behavioral therapy methods like no electronic device for an hour before bedtime, keeping your room cool 68 degrees or so, soft foam earplugs, keeping the room dark. And if those type measures don't work, then we need to watch you sleep for a night at one of our sleep labs and figure out what's going on. Do you have restless leg syndrome? Do you have occult sleep apnea? What is it that's keeping you from being able to sleep? You know, there are some people who, as soon as they lay down, their right brain goes to work and they start thinking about all the things that they've done wrong or they didn't do. Those are more challenging to treat. And those are the people that I say, you know, as soon as you turn off the light and you lay down, the first thing I want you to do is I want you to list 20 reasons that you are thankful that you are alive. Then I want you to say the Lord's Prayer, and then I want you to say the 23rd Psalm. Most of the time they're asleep before they get to the end. You know, if you don't want to do religious things, you can think of poems, but you've got to do something that turns off that part of the brain that starts making you feel guilty and remembering all the things you didn't get done that day.
Okay, what about melatonin?
Well, as Kim can probably tell you, melatonin has some beneficial literature. Unfortunately, it's made by 1 million different companies, and there's actually one study that used melatonin that suggested that it actually promoted tumor growth. So melatonin is not my number one sleep aid. And Kim, I'll let you go from there.
So there are a lot of bad quality melatonins, just like any other supplement. I do think it's safe in lower doses from about 1 to 3 milligrams if you get a good quality company that makes it. There are a few studies out there that Russ can probably talk about better than I, that use the higher dose melatonin to actually work against some types of cancers.
There's a smattering of information that would suggest that some very high doses of melatonin may be beneficial as an adjunct to conventional medical care of the treatment of what are called solid tumors. So not blood cancers or things of that nature. But it's very, very early. And literally the doses that are used there are anywhere from 10 to 80 milligrams. And we do see people who are taking, for example, 20 milligrams of melatonin off treatment for their for cancer in the hope that it will help keep cancer away. There's very little research data about that. It's not something that we typically recommend. And in fact, even with the melatonin, you know, just as Dr. Hopkins said, we're probably biggest fans with regards to management of insomnia using that cognitive behavioral therapy for insomnia. It's literally called CBT-I, CBT-I. Why? Because the research data there is probably strongest for that apart from anything else. And even when we're taking something natural for sleep, whether it's melatonin or valerian or anything like that, we still get it into our minds that I'm not going to be able to get to sleep unless I take a pill. And for the majority of folks, that actually isn't true. And not all the pills, again, just as Dr. Hopkins said, help us to get truly restorative sleep. So the idea is to learn again how to rely on ourselves so that we can get a good night's sleep without always having to reach for something external to ourselves to support that.
Okay, Kim, here's kind of a hot topic that's come in, and we just want to hear your thoughts about CBD oil and CBD pills.
So that has exploded since the fall of 2018 when the Farm Bill was amended to include that that plant, hemp, could be planted in all 50 states. So then that kind of opened up the gates for CBD to be supplied everywhere. It's still up to the states to make their own laws governing the CBD. So for example, in North Carolina, for a while we were putting it in foods and teas, and bars were adding it to drinks, and that's been outlawed now. That's against the law. So a lot of the regulations are still up to the states. We know that CBD has been FDA approved for only one use, and that is childhood seizures. And it is very effective for this. There are other areas that this is being researched for, but so far there's not a lot of strong research. But the areas are generally pain, sleep, movement disorders like restless legs and so forth, and PTSD. And just a few studies coming out on that, but it is not a cure for cancer. It is not a cure for diabetes or anything else. So there's a lot of false promises being made with CBD, and it's for sale literally everywhere now, on the corner gas station and convenience store, even in Marshall's and places like that. So you have to be really careful about the brand. And I did mention that at least 40% of the brands that are tested are not what they say they are. And there was one case where they used a synthetic CBD oil that actually caused seizures. So it can be dangerous if you don't get the right thing. And there are some potential interactions, although the interactions are more of a concern at the higher doses, which are not feasible with the products that are on the market right now. For sleep, for example, the studies that have been done with CBD and sleep used 200, 300 milligrams. And when you buy these drops or capsules on the market, you're not going to get anywhere close to that sort of dose. And I did the math one time, and to get a 300 milligram dose for sleep of CBD oil would cost you over $350 a month. So most people aren't going to take that sort of dose. So at the lower doses, the interactions are not so much of a problem.
Okay, and I think I've got time for one more question. I'm not going to be able to get to all of them, but soft foam earplugs was mentioned. Is there a certain brand of those, and where do you purchase them, and what exactly are they?
There are a million different brands. You can get them at the drugstore. You can get them at the grocery store. You can get them at the hardware store. They come like 50 to a box, and they cost about $3.50.
Okay, great. Okay, one more question is for Russ. Are mushrooms and mushroom powder the same?
So there are mushrooms that we eat, and that can be quite delicious. And then there are mushrooms that are used clinically that might be termed medicinal mushrooms. So as an example, shiitake mushrooms actually cross both. They are quite delicious when cooked. Indeed, you have to cook mushrooms in order to get the actual benefits. So, you know, all those raw mushrooms that you might see at the salad bar when we can go out to the restaurants again, we don't typically recommend eating them for a couple of reasons. One, there may be some compounds in those uncooked mushrooms that may not be good for us. And in addition, to get the benefits, you have to cook and break down the cell walls of those mushrooms in order to get access to the compounds that are beneficial for us. So shiitake mushrooms, maitake mushrooms, great mushrooms to eat, delicious, and also have some health benefits. From a supplement perspective, and Kim can speak more to this, we will often talk about some of the medicinal mushrooms that are used primarily in Asia, but that actually do have some at least compelling research behind them. And these would be things like something called turkey tail or Coriolis. There's another agent called cordyceps. There's reishi mushrooms. There's a lot of different agents out there that a lot of folks will say, well, mushrooms, I don't like the idea about that. But you can actually get from the ones that you like to eat, so a good amount of vitamin D, some other healthy components. Some of them have a reasonable amount of protein in them. And then from a health perspective, we often will recommend medicinal mushroom supplements for a few months, typically after somebody's gone through treatment or as long as they are not receiving an immunotherapy. Sometimes we have concerns about using medicinal mushrooms during immunotherapy because medicinal mushrooms also have an impact on the immune system. We just want to make sure we're not going to interfere with the good conventional medical care that they're receiving.
Okay, great. This has been wonderful. And before I turn it back over to Felicia, I just want to ask all the survivors out there who picked up their goodie bag at Cancer Services to please send us a picture of themselves wearing their mask and also a picture holding up their certificate, thanking all the people that helped them during their journey, and their certificate to show how many years it has been since they were diagnosed. And you can just submit those to our email address or respond to one of our daily emails you're getting from us And then your picture will be in our slideshow on Saturday at the party. So I'm going to turn it over to Felicia, and thank you all.
Okay, so this has been a wonderful program. I also want to add that I hope all the participants that are listening today will reach out to us here at Cancer Services. We're talking about survivorship and integrative medicine, and we can help those everyone with supportive services, medication assistance, and I just want you to know that we're here. So again, I want you to thank all the panelists for being here with us today. This has been wonderful, and tomorrow we look forward to hearing and seeing Julie Lanford, the Cancer Services Wellness Director and Cancer Dietitian. She'll give us tips and tricks on meal planning. So that's tomorrow beginning at 8 p.m. And I hope to see you all and many more here. Thank you so much. Thank you, Dr. Greenfield, Kim Rhodes, and Dr. Hopkins.
Thank you.
Have a wonderful day, everyone. Go. Is it just us? Oh, I can't hear you. Bye.